Good morning. Good morning, guys. So we're up early. Chastity has an orthopedic consult this morning, so we're getting ready. I'm gonna fix some breakfast. I'm gonna take a quick shower, brush my teeth, and wash my face. And I'll see you guys in a little bit. Say hi, Chastity. See you guys in a little bit. Hi, guys. So we're on our way to this orthopedic consult. We have to make a mad dash out the door. So I just dropped my son off because I waited to drop him off since all of us were leaving out the door today at the same time. It didn't make sense. And then I had to take a shower and everything and make sure she was together. So yeah, we're headed out and I'll talk to you guys when we get there. It hit me that you said that was taken. Okay. All right. Thank you. Bye bye. Good, honestly. Chastity.
No problem. I think he's at this point now. We're starting his mornings. Well, he's been sleeping off, but then literally an hour later, he's gotten back to work next time. And I don't really know if it's an hour. I want to do it.
Okay, guys. So we're here in the doctor's office, waiting for the doctor to come in. She had to change into some paper shards so the doctor could examine her legs. So we're here just waiting right now. And she's supposed to go over her x-rays before she comes in. So we're here again, like I said, for the orthopedic consult. And I'll be back with you guys once the doctor comes in, okay? See you in a little bit.
So Chastity's following up with me. You guys see Dr. A?
Yes.
Is that correct? You've seen Dr. DeVino, I guess, here in the Texas Children's Department. And then we're originally from Louisiana?
Yes.
Okay. How recently did we move?
Almost 4 years ago.
Okay.
We've been here for a minute.
And so her prior ortho surgery, the hamstring lengthening that she had done, was that done in Louisiana?
No, that was in Louisiana at Oxnard.
Okay.
She was seeing a doctor, Carlin, then. You have to wait until she's finished.
And I saw her video. So just a few little quick questions from me. Do we wear any braces?
No, she won't tolerate them now. Okay. She has some, but she been stopped tolerating them.
Okay. When was the last time you think she tolerated?
When she first got them.
Okay. Is that years ago?
Yeah, it's been a minute. Now, she wore braces when she was younger for years and years, but as she got older, she just wouldn't tolerate them.
Do you think we're having pain in there?
I think her pain comes from her feet. The deformities in her feet. She doesn't keep shoes on very long at all. Okay. So she has to usually, if we're going long distances, we usually have to have a wheelchair with her. Okay. So I can't tell, but I could tell she gets very aggravated and frustrated if she has to stand for a long time or walk for long distances.
Do you ever notice any swelling, any redness?
She does get like a little skin tears underneath. I think it's this one. It's just that underneath her toes. I guess that's from taking her socks off or dragging her feet when she walks because she throws her shoes off so much. But that's the only thing I've noticed.
We are 17. She takes baclofen and then the seizure medication and the risperidone.
And she takes guanfacine 2 milligrams also.
How did she do with her prior surgery with the hamstring?
It's been such a long time ago, but she did pretty good. She was in pain for a little while, as to be expected, but she had, a pain medicine and stuff.
And is she currently in physical therapy?
Yeah.
Where does she do her physical therapy?
She's at home. She's doing at home physical therapy, so it's not as extensive as when she was, going in.
Is that because of COVID or any other?
Yeah. She was in a group home for a little bit, so when we came back, she was doing it at Texas Children's. And then when she left, I think it changed, and then when she came back, she started doing in-home.
Okay. Does she do pretty well in therapy?
Yeah, she does pretty good, depending on the person, but she does pretty good. What are you talking about?
Okay, Miss Chasity, let me see your feet. This wasn't previous surgery, was it?
I think that was from a rub, from a cast. That she used to do casting.
You gonna relax?
Relax your toes, Chasity. Relax your toes.
No? Can they go straight? You want
She don't want her to mess with them.
I'm sorry.
Push your toes straight for her. Stop balling them up.
Is she clenching or do they typically stay down?
She clenches like that, I guess, because she's spastic. So she clenches like that, but I guess it's like it's kind of deformed like that too, yeah. Most of the time when you see that they are relaxed, it's usually when our legs are down.
I know, I'm pushing pretty hard. You're stretching? Okay, good job. There's a couple of things that we can do. For the most part, her foot is still very flexible. I can move it around. It's not stiff. It's not rigid. But it is kind of on the worser side of flat feet.
Right.
So
don't pull it. You go pull the whole little pan apart, Chasity. No. Let me see. There.
If we start with kind of minimal to more aggressive surgeries, the one surgery that's on the, I guess I'll say, our step A surgery.
Right.
Will very likely bring her foot over to a better position. One part is bringing her heel up underneath her so she doesn't do this motion.
Right.
And then the other part is bringing this part of her foot in a more afterwards. And hopefully the foot is in a better position. She's overall just more comfortable with that. Right. Very likely going to need to correct her bunion to pull this toe all the way over. Most of that is done with what we call soft tissue, so just the ligaments pulling the toe to hold it over. The small toes, for sure, the undersurface of these really to get these to lift up. But the bunion, typically for CP patients, because they're so spastic, I usually do have to make this part of the bone more rigid. So a fusion here to correct that. Okay. And then after surgery, she's in a cast on her feet and she can't walk for 6 weeks. She can't put her weight down. So during that 6 weeks, she's going to get used to being in the wheelchair. So physical therapy definitely is needed afterwards. Right. And really an intensive physical therapy because she's going to be weak and she knows that she can use the wheelchair. She's going to know that she can use it even more now. And we're going to have to remind her that we like to walk.
Right.
We like
and that's what she said, that she will probably have to have surgery at outpatient at Texas Children's. It needed to be more extensive.
Yes, ma'am.
Yeah, that's fine.
With the bilateral surgeries, I typically, I would do both feet at the same time, but I typically work with another surgeon,
right?
So that we can get through it pretty quickly.
She's talking about you. Listen.
She's been in the hospital probably about 2 days, and really that's for pain control, making sure that we have everything we need. You gonna pull me towards you? Making sure we have everything we need to get around, and not put our weight down. So we need a transfer board, shower bed, a rental wheelchair if we need something different than the one that you already have at home.
Yeah, because she's in the process of getting a new wheelchair now.
Thank you. And then from this step, so I would submit everything to my surgery scheduler. She would give you a call to find a date for surgery.
Now, are we doing anything? Because she was saying something about her tendons too. Are we doing anything else besides her feet?
No, let me go back and look.
Yeah.
So we are lengthening the tendon in the back of the ankle to get the
right.
down.
I think that's what she was saying. Yeah.
But from the rest of it, so bilateral feet, hind foot. So that would be part of the foot reconstruction is lengthening some of the tendons, but definitely lengthening this one in the back to get it all the way down.
Right.
So it's both a combination of bone surgery and soft tissue or tendon surgery.
Okay.
That would be done. We lengthen the tendon here and here. The bony cuts are made through 2 incisions on the foot. There's also some tendons that come down on this side, pulling too strong. This side, they're stretched out. So we tighten these tendons up. We loosen these tendons up.
Okay.
Yes, ma'am.
What?
Once we had a date for surgery, then we would have a pre-op meeting 2 weeks before surgery, in order to go over all the details of surgery.
Right now, I'm looking at maybe the summertime because we're about to go through the guardianship process with her, and I don't know how long that's going to take, and I know that needs to be done before she has the surgery. I know the lawyer said because of the area we are, it shouldn't take that long. Okay. So we need to get that done. And even if we weren't doing that, I just didn't want her to be pulled out of school.
I understand that.
So yeah.
That should work. I think the calendar, at least for the next 2 months, is pretty full. But I think summertime should be okay.
Yeah, give us some time to process everything that's
other doctors, her seizure medications, and if we have any concerns about that at time of surgery, then I would just consult neurosurgery in the hospital.
Right. So when she's in the hospital, she should get all of her regular medications while she's there, right? Yeah. Yes, yeah, no problem. Okay, we ready to get it over with.
Well, we will plan for that. I'll tell them we're looking more for summertime. And if anything changes with the guardian.
So guys, I just dropped Chasity off at school. She did not want to go to school, but it's still like 9 something in the morning. I think it's like 9:50. So I just dropped her off because we've done a really good time. But the orthopedic consult done well. She done very good. She went over everything basically, and I did record a lot of the stuff I posted for you guys to see. But she did well. It's going to be extensive surgery on both of her feet and some tendon lengthening in her ankles. And she will be out of commission for a while. So yeah, she has like some deformities in her feet where her feet are going outward and just her little toes where she ball them up and everything. So it's really uncomfortable and it's probably really painful for her. So hopefully when this is done, we can get her back in some braces to help align her feet better, and so this won't happen again. And she'll also have to do extensive therapy, and she'll be in a wheelchair for a long time. So this is done, you guys, and I'm so happy we got this out. could move forward, you know. So I'll talk to you guys in a little bit. You guys have a good